Good evening, everybody, and welcome to tonight's event. This is sponsored by the League of Extraordinary Black Nurses Leadership Institute. This is one of several programs that we're going to have throughout the year, and I'm really excited about this one because nursing is so diverse, and there are so many different pathways and avenues that you can take. And I'm thankful to my panelists tonight who represent are experts in their fields and have graciously agreed to come on and share with us tonight their experiences, their journeys, what decisions led them towards the career paths that they took. And I think that you guys will really be enriched. And please feel free to put any questions that you might have for our panelists in the chat. If you're streaming live, please put your comments under the live feed. I will be checking to see if anybody has any comments via the Facebook group. And also, if you are not on the panel, just for the sake of the recording and the way that the video shows up, just turn your cameras off for me. You will be able to turn them back on once we do the breakout sessions. And if you have a question or something, you can certainly turn it on so we can see your lovely faces. But just while we're doing the actual discussion, if you could keep your cameras off, and unless you're a panelist, and put yourself on mute to eliminate any background noise unless you're speaking, okay? Awesome, so those are the ground rules. I will now share my screen because we have just a little bit of an introduction and we're gonna get kicking here. Okay. All right, so again, welcome, welcome, welcome. Tonight's topic of discussion is nursing career pathways. This event is sponsored by the League of Extraordinary Black Nurses. And I didn't even introduce myself. I am Dr. Dania Dunkley. I am the board chair and founder of the organization. And tonight, the next voices you'll hear, I'm going to be presenting our speakers for the evening and also our co-moderators. So first, we have Vicki Schmidt and we have Erica Dingle, and I'll just take a moment here to share a little bit about both of them. One moment. Sorry. Okay. So Erica Dingle is one of our board members, and she currently oversees the social media relations of the League of Extraordinary Black Nurses. She's currently enrolled in a graduate medical program and is looking forward to a career in medicine. Vicki Schmidt she received a Master's of Science in Nursing. She's a family nurse practitioner, and she's currently working on her DNP in leadership at Walden University. She's worked independently as a family nurse practitioner in Las Vegas, Nevada for the past 3 years, with 11 years prior experience working as an RN, mainly in hospice care. Ms. Schmidt is part-time adjunct faculty at Arizona College of Nursing in Las Vegas, and she's also a volunteer for the Medical Reserve Corps of Southern Nevada, where she provides medical services in response to state and local emergencies. Ms. Schmidt serves as another board member for LEBN, and her focus is community engagement and partnerships. So I apologize, I think the slide advanced by mistake. All right, let's go back to our slideshow. So now that I've introduced our co-moderators for the evening, I would like for them to take over, and I'm gonna fade into the background, but I, of course, will be here if anybody has any questions for me. Take it away, ladies.
Good evening, everybody. This is Ernest Williams, and she's an experienced nurse and health law attorney that works with healthcare providers who want to protect their license, decrease liability, and mitigate risks. After working in operating room and pre-op PACU years ago, Ernest decided that she would do more for nurses, patients, and healthcare system by working to change healthcare as a legal advocate and social justice change agent. As a graduate of Howard University and the Howard University School of Law, her practice is deeply rooted in social justice, and she serves as an architect of social change for both the clinicians and patients in the community. Ernest still works as a travel nurse and runs her practice while also trying to find the balance of supporting her own family.
Hey everybody, again, welcome. I have the pleasure of introducing Dr. Joe Schmidt. Dr. Joe Schmidt is a family nurse practitioner who manages the clinical operations of health services for the New York City Administration for Children's Services. ACS is New York's child welfare and juvenile justice system, and here Dr. Schmidt ensures that youth within this system receive comprehensive, trauma-sensitive healthcare services. She also practices family medicine several days a week at a small health center in Harlem. Dr. Schmidt is an active member of both Chi Eta Phi Nursing Sorority and Sigma Theta Tau Nursing Honor Society, and also sits on the board of the League of Extraordinary Black Nurses.
Okay, next is Dr. Michelle Pinckney. She received a Doctor of Nursing Practice in Executive Leadership degree from Capella University. She currently serves in the role of Psychiatric Mental Health Nurse Practitioner in the Emergency Medicine Department at the Department of Veterans Affairs, located in Loma Linda, California. She's been employed with the organization for 18 years and has served in several roles to include staff nurse, case manager, nurse manager, and associate chief nurse executive for mental health. Dr. Pinckney is a contributed part-time faculty with Walden University and Charles Drew University in the School of Nursing Psychiatric Mental Health Nurse Practitioner program. She's licensed as a PMHNP with the state of South Carolina, Nevada, and Minnesota, sorry. Dr. Pinckney also runs a virtual PMHNP practice where she provides services via telehealth to those suffering from mental illnesses.
Next up, we have Dr. Michelle Johnson. Dr. Johnson is currently the Director of Nursing Education with the Nevada State Board of Nursing. She holds a Doctorate of Education with a concentration in educational leadership, and she is the editor of the Nevada Nursing News. Dr. Johnson has been a nurse for 29 years, a pediatric nurse practitioner for 25 years, and an educator for 23 years.
Okay, next, Marilyn Reidenauer is a captain in the United States Public Health Service assigned to the National Institute for Occupational Safety and Health. From 2005 to 2007, she was in the Epidemic Intelligence Service Training Program. And since 2005, she worked on workplace violence in healthcare. From 2007 to 2020, she worked as a nurse epidemiologist and was project officer for the Healthcare Violence Prevention Online Best Practices course, the Workplace Prevention Programs in New Jersey Healthcare Facilities project, and the Taxi Driver Survey on Motor Vehicle Safety and Workplace Violence. Starting in 2020, she is Scientific Review Officer, or SRO, in the Office of Extramural Programs. Captain Reidenauer received her Bachelor of Science in Nursing in 1984 and her Master's of Business Administration in 1988 from WVU, and her Master of Public Health in 2002 from the University of Pittsburgh. She became certified in public health in 2007.
Dr. Lorianne Vick. During her nursing career, Dr. Vick worked in a variety of areas, including the neonatal intensive care unit, adult critical care, internal medicine, cardiology, and sleep medicine. Embracing the role of a lifelong learner, Dr. Vick furthered her nursing education, earning a Bachelor of Science in Nursing from Chicago State University and Master of Science in Nursing from Rush University, majoring in the acute care nurse practitioner and critical care nurse specialist programs. Her final degree, a doctorate in nursing practice, was completed at the University of Illinois at Chicago. In 2017, Dr. Vick relocated to Las Vegas to become the telehealth service chief at the VA Southern Nevada Healthcare System. Through her leadership, the telehealth program has flourished, which has substantially enhanced access to care for the veteran population. In addition to her work as a clinician and leader, Dr. Vick is also a nurse educator. She has held faculty appointments at Rush University, the University of Illinois at Chicago, Chamberlain University, and Nevada State College. Dr. Vick has also published and presented at local, regional, national, and international conferences. Dr. Vick, along with 16 of her esteemed colleagues, chartered the Eta chapter of Chi Eta Phi Sorority Incorporated in the year 2019. She currently serves as the chapter vice president and will soon transition to chapter president later this year.
And we have Dr. Kim Stevens, who provides informatic guidance and practices as a liaison between clinical and users and IT departments in healthcare operations, leveraging both clinical knowledge and informatics knowledge to provide innovative solutions. The CEO of the healthcare informatics company, Nurse It, Dr. Stevens is a registered nurse with 27 years of practice. In 2013, she graduated from Walden University with a Master's of Science in Nursing, specializing in nursing informatics, and practiced as a nurse informaticist from Howard University Hospital, Southern Regional Hospital, the George Washington University Hospital, and the National Institute of Health Clinical Center in Bethesda, Maryland, where she supervised the electronic health record training team and the users access management team as a coordinator of practicum experiences with graduate level nursing informatics students. Dr. Stevens completed Walden University's Doctor of Nursing Practicum curriculum with a focus in clinical informatics in 2019 and is currently advocating on improving usability of information systems and clinical applications for clinical end users. Currently, she practices as a senior clinical informaticist with the Cerner Corporation Bayer Institute in Washington, D.C., and is a limited term lecturer at Purdue University Northwest College of Nursing Informatics course for the undergraduate and graduate students, and as an academic coach for the Instructional Connections. Dr. Stevens, a member of Health Information and Management Systems Society.
So ladies, thank you again for being here with us tonight. We have an amazing group of women and hopefully men as well that would love to learn from you this evening. So we're going to get right into it. I would ask that you limit your responses to between 3 to 5 minutes if possible. So our first question, and in any particular order, just go ahead and answer. Why did you select nursing as a career? Okay, yeah, Dr. Joe. Yeah, I'm gonna start picking people. Go ahead, Dr. Joe.
I feel almost like nursing chose me. I feel like I've always been a nurse since the time I was little, though I didn't quite know it. I had an elderly grandmother who suffered from diabetes and had gotten sick later on in her life, and I was around her care, she had open heart surgery, and I was probably about between 8 and 10 years old. And she had a home visiting nurse that would come and take care of her dressings, and she had a hospital bed in the house and everything. And I remember this nurse allowing me to assist her. It was like a wet to dry dressing. I didn't know that at the time. She had this huge opening in her chest, and she had this wet to dry dressing. And I wasn't afraid of it at all. I wasn't grossed out by it. I wasn't afraid of it. And I remember the nurse asking me to come and if I wanted to look at it and if I wanted to help her out by handing her some things. So that was something that sparked me pretty early on. And from there, I just remember playing with dolls and doing things like hooking them up to IVs and giving them vaccinations at a very young age. So I guess that kind of carried over with me as an adult. And then as I got older, I needed to support myself and my son. So I needed something that was stable and something that I knew I could always have a job. And so I knew I needed something that would fit my interest, that I was also good at, and that I could make a living at. And it kind of was a no-brainer at that point. And I think, like I said, I think that's many people's story, that their story sounds a little bit different, but they feel like kind of nursing chose them, that they've always had this nursing background or personality, call it.
I think for me, like with Dr. Schmidt, I knew early on that I wanted to have a career in the healthcare industry. I don't even remember this, but I have a friend that knew me since we were like toddlers. And she always tells the story of how I always wanted to play doctor, and she was tired of being a sick patient and she wanted to be a star. So so it's funny because now I'm a nurse and she is an entertainer, by the way. So it's funny how life works out. But I wanted to be a physician starting out. And in high school, they actually had a LPN program. And so I really didn't want to go into the LPN program because I wanted to be a doctor. You know, I'm not going to do that. So my mom encouraged me to try it out to see like if I really wanted to be in healthcare or not. So I did end up graduating from that program, and I really fell in love with nursing at that time. Mostly because what I noticed is that the nurses were always there at the bedside. The doctors come and go, and then the nurses are there, with what's left behind. The patients never really understand what the doctors are telling them, right? Or they're getting this devastating news and they're in and out, and that nurse is there to really provide that care, but also that emotional support that goes along with, or that's needed when someone is dealing with an illness or, being away from their family and things like that. So that's what really was the deciding factor for me. And I hit the ground running and I never looked back.
So I guess I'll answer the question next, and I'm probably going to be the comedian of this answer because I truly became a nurse. Well, I wanted to become a nurse from the character of the soap opera General Hospital. Everybody remember Lucy? I don't know, I might be dating myself, but Lucy was a character on a soap opera and she was always behind a nursing station. I was like, oh, wow. I want that job. Like she had her whites on, with her little hat on. And I was like, that's what I want to do for a living. Little did I know, right? As a charge nurse, you do not just stand behind the desk and take care of patients and look pretty for the camera. But I think in my studies early on, I became a mother of a premature infant who had to spend some time in the NICU. And that's when everything that the other panelists have said became fruition in my life. Like I had this baby and it was other babies around him. And I'm like, wow, you know, look at the people that are keeping him alive. It wasn't the doctors that I could call every shift to see how he's doing, if he's feeding, how much he weighed. It was the nurses. And it was the nurses who created a relationship with me. And then from that experience, I mean, he came home as a poor feeder. He wasn't necessarily thriving, but just from their energy, I became that parent that, yo, I'm going to do what I need to take to keep him alive, and which I did. But I continued my education with that experience behind me and wanting to give back to families and make sure that I was instrumental in people moving forward in their health progression and goals. So that is how I became a nurse.
Okay, I guess I'll go next. I think I can echo Dr. Joe Schmidt. Nursing kind of chose me early in my life. I was trying to decide what course did I want to take. Did I want to be a school teacher or airline stewardess at one point? And by the time I got through with high school, I did studied a nursing assistant in different fields, working in a doctor's office, and I just kind of fell into it. There was an advertisement at the school. They were recruiting for an LPN program, and I signed up and completed the program. And I worked as an LPN amazingly for about 6 years, and I had no intention of going back to school for anything. And then I started looking at all of the other students that were coming out of the BSN program, and they did not have as much clinical knowledge as me, because I literally, as an LPN, did all the work. So that encouraged me. That was one encouragement to go back to school. So I took the slow train to get where I am. I got my associates first, then I got my BSN, and then I went the master's route, and then here I am with my doctorate. But all in all, it has been very rewarding. I do not regret not one day, and I am very thankful. Again, like Dr. Joe Schmidt said, you know, you have to look at a career where you're going to be able to take care of yourself. I also had a daughter that I had to raise, so that in itself helped me to have a better quality of life for her and for myself together. So I guess that is a little bit about how I became a nurse.
I guess I'll go next. I think probably my story might be a little different because I have no idea how I ended up in nursing. It was kind of like, it was just where I was supposed to go and what I was supposed to do. I mean, I went straight into college out of high school. I went into nursing school right away. So at 18, I was in nursing school. And I think all the things that I kind of like imagined that I would do, I did them, and they all fell within the realm of nursing. But I can't remember. I remember maybe playing Operation when I was a kid, but I don't know how I ended up in nursing school, but it was kind of like that was where I was supposed to go and what I was supposed to do, so I did it.
Yeah, so I think I have a very similar story to Dr. Schmidt. I was raised by my grandparents who, as I got a little older, they were really sickly and they had a nurse's aide, and I was always in the hospital with them, and I just loved the care that they received from their nurses. I don't remember many doctors except maybe their primary care doctor, but I do remember a lot of nurses who would just come in and care for them and the care that they provided, and I wanted to give people the same experience that my grandparents had as they got older. And so at one point I thought I wanted to become a doctor, and then I got into nursing school and was like, ooh, I don't really care for doctors. No offense. I know someone here is going to medical school, but it just wasn't what I wanted to do because I wanted to be more present with the patient. And so nursing school really allowed me to see how intricate nursing was, and it wasn't just one thing that nurses did, and how you could take that career anywhere. And so it gave me the opportunity to support myself and to make sure I always had a job. My dream was to work at Hopkins when I graduated, and I just happened to get that job right when I graduated. And then my dream was fulfilled, and I was like, okay, what's next, right? And so nursing gave me the opportunity to explore so many other different things. And I think that's what I love most about having a nursing degree, that it doesn't put you in a box, but it actually gives you a lot of opportunities and options.
So I'll go next. My mom wanted to be a nurse, and so she went to nursing school in 1955, but then she got married, and at that time, if you were married, you could not be in nursing school, so they kicked her out. And so she had, I was one of 6, I was the youngest, and so I always knew that she wanted to be a nurse, and her and I have the similar personalities, and we like to help people, so that's why I picked nursing, and I knew I could get a job anywhere, and it's a stable career and I can make a living. And so that's why I became a nurse.
Wow, you guys all have different interesting stories. Okay, so I'm gonna ask you another question. It's sort of a 2-part question here. What was your pathway to becoming an RN, and describe some of the various specialties and roles you had during your career leading to this point?
So I'll take this one first since I was last on the other one. So I've had a 35-year career. And so I started out, and all of these jobs were intentional. None of these jobs were accidental. So I always applied and I got it or did not get the job. So I started out in floor nursing on an orthopedic and oncology floor, and then moved on to cardiology floor. And then I moved to, I first worked in West Virginia, and then I moved to Pennsylvania in Pittsburgh, and I worked on another cardiology floor for 5 years. And then I became an infection control practitioner and did that for 5 years. And then sort of I moved jobs about every 5 years, and then I became an RN analyst at the same hospital. And so looking at infection rates and other quality issues at the hospital. And then I wanted to move back to West Virginia. So I had to think about how I could get back to West Virginia. I wanted to get a federal government job. And so becoming an epidemic intelligence service officer, you had to have a master's of public health if you were a nurse. So I went back to school while I was in Pittsburgh and got my master's of public health, and I applied, and I was able to get in. So it's a 2-year training program, which is an excellent opportunity to learn all about epidemiology. And so from there, I stayed on at where I did my training at NIOSH, and I became a nurse epidemiologist. So I did research in workplace violence toward healthcare workers and taxi cab drivers. And then last year, I moved into the scientific review officer position. And so that allows me to look at NIOSH from another perspective. We do a lot of extramural research funding. And so my job is to conduct the review meeting and make sure it's fair and across all boards. And that's my 35-year career.
So I've been a nurse for 12 going on 13 years. I started my career, I guess, I went to Howard straight from high school, skipped the 11th grade. I wanted to go into the Marines. My aunt told me just to apply to college, and I was like, okay, I'll apply. I applied thinking that I wouldn't get in, and I got in, but I immediately chose nursing as my major. And Howard at the time, I don't know if they have it now, they didn't have a TEAS. So as long as you had the prerequisites, you could automatically kind of go into the program. I, of course, failed one of the prerequisites, which then delayed me by a year, but that actually was the best year of my life because I could take non-healthcare classes with normal people and have lots of fun. But I knew I still wanted to be in the nursing program. So once I finished that prerequisite, got into the nursing program, I graduated. So instead of 4 years, it was 5. So I graduated with my BSN. took my NCLEX and I was working in the OR as a student, and the OR surgeon convinced me to come to work that morning before my test because it would calm my nerves, and he wanted to start at 6 and nobody would come in at 6. So I went to work from 6 to 10, took my test at 12, found out I passed, and then transitioned from a student nurse in the OR to an RN in the OR. So that kind of was my pathway to nursing, and I've stayed in healthcare even though I went to law school, oh my goodness, so many years ago. I graduated in 2014, so I went to law school in 2011. But when I graduated, I couldn't find a job as an attorney that paid as much as I made as a nurse, which was really sad. And then some interviews that I went on, people would say, well, why would a nurse become an attorney? And they would want to talk about my nursing career and not really about my legal experience. And so I ended up just staying in healthcare and working and trying to figure out how I was going to combine my two careers, which, you know, has led me to do a travel nurse and just build my own practice with my own money. So nursing is so much, like, as much as people are like, oh, why would you still be a nurse? I'm like, because I can always, like, literally always have a job. Like in a pandemic, I have a job. While all other attorneys were afraid of losing their jobs, I was able to make more money than I was even making before. And so, you know, once again, I'm just so grateful to have this degree, especially during this time where others have kind of been unstable, and I've kind of been able to have a definite two careers that are very stable.
Okay, I think I'll go next. Okay, so I started out in 1992 as a LPN, like I said, and in 98, I went back and got my RN. I worked med surge and mental health. So I was more leaning toward the mental health field than to the med surge. So I love about nursing is that you can literally, if you decide you want to try or do something else, you can try and do a little bit of everything. You're not just stuck. So I worked as a med surg nurse. I transferred to the IV team for about a year. When I wanted to go back to school, I transferred to the nursing home, and all of this was at the Department of Veteran Affairs. So I transferred to the nursing home. I worked part-time and I worked full-time. And I also became a travel nurse at one point. I wanted to kind of get out and do some things. And that's how I ended up on the West Coast, taking a travel assignment and going back and forth as I was working. So in 2010, well, in 2008, I took a job full-time on the West Coast as a case manager in a dual diagnosis treatment program. And from there, I moved up to be a nurse manager in 2010. So I was a nurse manager for about 10 years. And one thing I like about working with the facility that I work with, Department of Veteran Affairs, you can transfer, you can literally just go on USA Jobs, see something you want, apply for it, do a phone interview, and start packing your bags. So, so that led to my longevity in one facility. If it wasn't for that, I probably would have not had more than a couple of years at one location, because I think now looking back, I have a problem with sitting still. So that is my passion. That is my love. In 2017, I got a master's. I completed in December of 2017, my psychiatric nurse practitioner certification. And I had no intention of ever working as a psych NP. I only did it to just for the knowledge, to just add to my portfolio. So a couple of years later, I decided, it was actually when I was in Oregon for a year working as the associate chief nurse. There was a lot of solitude because the little town that I was in was like 3 hours from the main airport. So I had a lot of free time on my hands. So then I started studying to take the certification, passed it, and then started working on my NP certification. So since then, I accepted a position full-time, and that's how I ended up here in Loma Linda, working in the behavioral medicine. And then January of 2020, me being the person that I am, I just decided to file for a LLC and start getting credentialed. So I celebrated this past January 1 year in my private practice. And I'm so sorry for the COVID pandemic, but out of the COVID pandemic, they got kind of lenient with the telehealth. So I was able to kick off my own virtual private practice. I worked towards that. So back in September, I really started seeing patients, independently on my own. And as of today, it's going very well. The private practice is, I'm licensed in several states, and I literally can sit in my spare bedroom on my laptop and see patients and diagnose them and prescribe from an app on my phone to the pharmacies. So that's like the evolution of my, where I am today in nursing and how I got started.
So as I mentioned earlier, I started my nursing career in high school as an LPN. And I followed the traditional path. So, as soon as I finished high school, I went straight and worked on my bachelor's. Unfortunately, at the time, and Dr. Pinckney and I kind of became LPNs around the same time. It was very difficult to find an LPN job if you didn't have experience in my neck of the woods in Chicago. So that just allowed me to focus on school, which I did. So I got my bachelor's, then spent a year working. Really, my passion or my goal at the time was to become a CRNA, or nurse anesthetist. So I'm like, okay, well, where are the nurse anesthetist programs? And so Rush University at the time had the #1 program in the nation. So I said, oh, well, I need to get there. So I applied for a position. One thing that I have to say is when you say that you're never going to do something, you end up doing it. So I said that I would never, ever, ever be a pediatric nurse. And I landed my first job at Rush in the neonatal intensive care unit, which by the way, actually probably was one of my most favorite jobs. So got there, realized that as a nurse anesthetist candidate, I needed to actually have adult ICU experience. So I transferred to ICU, got the experience, applied for the CRNA program, and was rejected. So I was encouraged to reapply the following year. At that time, I was in advanced pharm, was struggling because I did not give that class the respect that it truly deserved. So I applied again for the nurse anesthetist program, did not get in again. So my advisor says, Lori, I really don't see you as a nurse anesthetist. Like you are, they have this, and I think it's a misconception, as a nurse anesthetist, you just don't take care of people when they're asleep. That's all you do, right? So I see you as a people person, and I could see you as the dean of a nursing college. And I'm like, I'm not trying to hear that. I'm trying to get into this nurse anesthetist program. Forget what you're talking about. But anyway, it didn't work out. And so I'm grateful that she saw something in me at the time that I didn't see in myself. Because actually where I'm at now, it almost makes me want to reach out to her and say, you were right. I'm not the dean of a college of nursing, but I'm a chief of a service. And I really am kind of a people person. I really enjoy the coaching, the developing of other people. So it's a nice fit for me, which I would have never thought. I never thought that I would be where I was. As a matter of fact, I didn't even know when I got the job, it was a chief position. I applied for this job that it was announced at the VA incorrectly. It was announced as a non-supervisory position, and it was a facility telehealth coordinator position. So I thought all I'd be doing is developing these wonderful telehealth programs and not dealing with supervisory stuff, because I did not want to be a supervisor. I would never be a supervisor. So I got the job, and I wanted to relocate. That was my job. That was my intent. So like Dr. Pinckney said, at the VA, you could, pretty much decide you're going to go somewhere else and apply, get a job, and move on. So I get the job, I come to Las Vegas, and I'm signing these documents, right? And the documents keep saying chief. And I'm like, why do these documents say chief? I'm not a chief. I'm a facility telehealth coordinator. And people would look at me so strange. It's just funny. So I say that to say, sometimes these opportunities kind of fall in your lap. And I'm grateful that it was not posted as a chief position. And I'm glad it was not posted as supervisory, because I would have never even applied, because, we're our worst critics. And I thought that I wouldn't even been qualified for that position. So, the two things, never say never, because you are going to do those nevers. And two, sometimes things fall in your lap, and when they do, just take it and roll with it. So I'm grateful for those experiences.
Absolutely. So I guess I'll go next. In my pursuit of trying to be Lucy, I had became a medical assistant, and I was married to a Marine, and as we were getting stationed to different places domestically, and I would take a job as a medical assistant here and there while taking my prereqs for nursing school. I actually did a year in Cleveland, and then we got stationed to California, and I had to take those credits from Cleveland and go to California to start with the associate nursing program. So I kind of followed the pathway as Dr. Pinckney. I got my associate nursing program in Southern California at Golden West College. And out back then, there was a nursing shortage. Like, you didn't graduate nursing school and have a job. You really had to compete to get work back then. And I graduated in 1993. I don't know if any of the other nurses was practicing during that time, but they had brought a lot of nurses over to the United States, foreign nurses over to the United States to fulfill a nursing shortage that we had before I graduated. So when I graduated, you know, you had to beg, borrow, and steal to get a job. And then I'm married to a Marine, and we kept moving around. It was very difficult. So I started my career in juvenile health, right, at a juvenile center in Los Angeles. And that was very eventful. But then we got orders to Atlanta, and I worked at the Grady Health System. If any of you guys know about Grady in Atlanta, with, you know, it's greater. And so I worked there and became a nurse. Like, I became a nurse. We had IV pumps where we had to put syringe. I worked in on the pediatric side. So we had to do our antibiotics, do a syringe, right, with a rubber band on the IV pump in order to do those secondary IV drips. And so you learned how to be a nurse. You learned how to take care of patients in any environments. But outside of that, like, I grew in love with caring for the underserved, right? That was my heart. And then after working at Grady a little bit, and I went down to the emergency room, became a pediatric emergency nurse. I was getting a little burned out because I was one of those that took advantage of all of the overtime, right? Because in nursing, you can do that. You want something, you just pick up the overtime, or you go get your agency job or something different. And I became a little bit burned out. I went to Kaiser, became a pediatric supervisor, and then I got a divorce from the Marine. Well, that was the best thing that ever happened in my life, because he wanted to take care of those children, right? And so I had these kids, and he wanted them in the summer. And I thought it was like, oh, this is cool. You mean I don't have to keep those kids during the summer? So in the summer, I became a travel nurse, right? They went to Daddy. I went to California. I went to, Hawaii. I just went everywhere as a travel nurse and racked up all the money. And then during the school year, I could be a PRN because we had enough money to make it. And I could pay more attention to my children. I'm not telling anybody to get a divorce. I'm just saying it worked for me. That's all I'm saying. And so with that, I worked as a travel nurse. And then one summer I went to Howard University, Dr. Williams, I went to Howard University, and I worked in the emergency room there as a travel nurse. And so they allowed me to lump my days to work 6 days in a row. So 6 days on, 10 days off, because you're doing them in a row. And I did that for 18 months and moved back to Atlanta, lost my mom, and the manager at the time, when I was going through that crisis in my life, reached out to me in Atlanta and offered me an assistant nurse manager at Howard University emergency room. And so I did transition myself, yay, HU. I transitioned myself up to the area with my daughter. It was one child left to raise. Went up to Howard, and then life just totally changed, right? Because I got a manager position. So then I jumped back into leadership. And at the time, I noticed that there was an issue with communication. Like, all you guys remember when we used to have those paper charts, and we would have that chart. You got to go look for the chart, right? You got to find a chart. You got to see who wrote in the chart. Did you forget to write your notes? What did the doctor say? Is this prednisone? Is this 60 milligrams or is this 40? Like, we had to use our, telepathy to figure out what the order was. And so it just drove me absolutely crazy. And so at that point, I decided I was going to go to school and study at Walden University and study nurse informatics. And I studied nurse informatics. We did some projects there that helped our communication at Howard. And then I left the assistant nurse manager job, worked in their IT department. And from there, that's how I transitioned my work into the informatics space. And now as a DNP and doing COVID-19 and watching practitioners like Dr. Pinckney and even, Miss Nurse Vick, practice, right, with telehealth and teleservices and how they're able to improve their access to care, then that's what I focus on. Like, how can we reach our patients? How can we improve communication? How can we report the data, right, on how we take care of patients and get it back to where it need to get to, so that we can make informed decisions and improve the healthcare delivery system and the quality of health that our patients receive. So that's how I got into nursing, and that's where I'm at now.
I'll go next. As I said, I kind of went the traditional route. I went to college at 18, University of Michigan, graduated in 1992 with my BSN from U of M. And then Dr. Kim, I was a Grady nurse. I moved to Atlanta and I was a Grady nurse for 3 years in the NICU. And I never was a staff nurse ever again after that. So you can imagine the torture and the things that I went through working in the NICU there. But anyway, while I was in Atlanta, I went on to get my master's degree and became a pediatric nurse practitioner. Originally, I had always said, I'm gonna be a clinical nurse specialist. I studied what clinical nurse specialists study, worked under clinical nurse specialist. I was like, that's what I want to do. That's what I'm going to do. And I never was a clinical nurse specialist, at least not in the NICU. And I always tell students to be open to the possibilities, because my career has taken me in many different avenues because I was open to the possibilities, or I went and worked wherever I could find a job. So after I got my master's degree, I left Atlanta and I went back to Detroit, and again, couldn't find a job. And so the job that I found was in a school-based clinic in a high school in Detroit. And so I went into adolescent medicine. So I went from NICU to adolescent medicine. Like I said, I've done all extremes of pediatrics. So I did adolescent medicine for 4 years. And while we were at the clinic was owned by the health district, by the Detroit Health District. And we had some issues. So we go into work one day and we all are out of a job. So it was kind of like, so what do I do now? And they found a position for me actually in the sickle cell clinic, in the pediatric sickle cell clinic. And again, I was a nurse practitioner at the time, and not worked with sickle cell or had not worked in HEMOC with any stretch of the imagination. But I did it. I learned everything that I could while I was there. I did that for a year. And I had decided, well, I want to move to Las Vegas. I always wanted to move to Las Vegas. Also, while I was doing that, I got my postmaster's certificate in nursing education. I said, I'm never going to get my doctorate degree, but I'll go and get that postmaster's certificate in nursing education because I always wanted to teach. So that was the route that I wanted to go. And I did start teaching. I started teaching from University of Phoenix, adjunct. And with all my years in pediatrics, which I think this is the funniest thing, I've never taught peds. I have taught about everything, not any adult stuff, but I'm not an adult person. But I did community health for many, many years, research, health assessment. I mean, I did everything but psych, med surg, and peds. Could have did some OB, but I never taught OB, but anyway. So I left Detroit and moved to Las Vegas and got a job with Southwest Medical and did primary care pediatrics. I did that for 4 years. And what happened was, on the way to whatever, I was working with a physician, and at times he was a big jerk, and I was standing behind him, and he did not know I was standing behind him, and he started talking about me. So at that point, I went in my office and I said, that's it. I'm going back to school and I'm going to get my doctorate because I'm going to be the doctor. So that was when I signed up with the University of Phoenix, and that was in 2003. So, and that was when online education was very new, and we were all afraid of, like, what are people going to say? We got a degree from online. Is it going to be less? So that was a big worry with my classmates. Because I loved education, I went and I got the doctorate in education, educational leadership. I did leave the clinical practice in 2004 and started teaching full-time in Nevada State. And I taught full-time at Nevada State for 7 years. And then I had completed my doctorate by then, and I got the opportunity to get what I thought was my dream job. So what my dream job was gonna be was teaching online full-time. So I actually got a position as a program director at a school in Connecticut, and started teaching, and I had been teaching adjunct everywhere, but I started teaching full-time adjunct with them and being the program director for the nurse education track, which I love to teach people how to teach, and that is one of my specialties. So I did that, and I actually did that for, I think, 3 years before my husband and I decided to move to Hawaii. And I said, well, we can live in Hawaii because as long as you get a job, I'm teaching online, I can live anywhere. And I did travel, I had to travel 4 times a year. It's back and forth from Hawaii to Connecticut. It's not fun, but I did it. And working that dream job, I had decided, well, you know what? I really want to get involved with the community. Living in Hawaii, I just really wanted to get more connected to the community. So I left my dream job and I took a job at Hawaii Pacific University. So I went from a program director, I went back to faculty. And then within 1 year, I was approached by the grad chair, and she says, I'm leaving. Do you want to be grad chair? So I said, I guess. And the following year, the dean said, I'm leaving. Do you want to be the chief nurse administrator? And I'm like, oh, okay. So I ended up being the chief nurse administrator, which is basically the same thing as being the dean and director, but I was not the dean because we had a dean over us, but it was a dean of social work, public health, and nursing. But I became the chief nurse administrator of the nursing department and remained as grad chair. So I had the 2 jobs. And I did that for a few years up until 2019, had some issues, and we left Hawaii. I didn't really want to leave, but I did leave Hawaii, and I came back to Las Vegas, and then I tried to find a job all over the United States of America. I mean, I was applying in Indiana, Ohio, I mean, anywhere. I was applying for jobs everywhere. And it took me 6 months to get a job. And I had gotten a job at a school here in Las Vegas and had just started that job, had saw the job with the Board of Nursing, Nevada State Board of Nursing. And I said, well, you know, maybe I should apply for that job. I did have a little bit of experience because when I was the chief nurse administrator, I was a appointed to a facilitator position with the American Association of Colleges of Nursing. So I did have an AACN facilitator position, and I absolutely love working with AACN. And I was like, this is my niche. I love this. I love the policy aspect of it, the camaraderie. I just absolutely love that side of nursing education. So I got the job with the Nevada State Board of Nursing, and now I am the Director of Nursing Education for the state of Nevada, and also the publisher of the, which I never thought I'd be a publisher of the magazine, but I'm comes along with the job to be the publisher of the Nevada Nursing News. And that's my story. I'm sticking to it.
I think I'm last. So I've been a nurse for 19 years. I got my bachelor's of nursing, and then I went straight into med-surg nursing, but I went and started out on like a hodgepodge floor. We did oncology, hospice, detox on the floor. So I learned a lot that first year. And then after the first year, I went and became a travel nurse, like a couple of the other people on this panel. And I did that for about 6-7 years. And then the last half of my RN career, I worked for the New York City Department of Health and a program called Nurse Family Partnership. And Nurse Family Partnership is a mother-baby program. And we work with underserved moms who are at risk. And we do nursing assessments of the mom during her pregnancy and work with the infant and assess them for things like childhood development and screening for autism. So it was a wonderful program. And then I moved into getting my master's degree. I went to NYU, and I became a family nurse practitioner. And my first year, I started off like Michelle in school-based health clinics. And then I moved on to just an FQHC, which is a federally qualified health center. And I worked there for about a year, and then I landed my job here at ACS in New York City, which is a child welfare system. During that time, I had also got accepted at Yale and was completing my doctorate. So I went right from my master's to my doctorate degree. I've been in child welfare for about a year. And also now simultaneously, I'm also practicing out of a clinic, a health clinic, and seeing patients. In the child welfare services, I run clinical operations. So I supervise nurses. I also, I make policy for the health centers that are associated with the child welfare system and juvenile justice. And I see kids and approve whether or not they can be medically cleared to go into the foster homes or to go back home. Sometimes I have say on whether we think the child should go back home or to a certain foster care provider based on their medical problems or medical conditions. So it's a lot to unpack in my current position, but it's one of the most rewarding positions that I've had throughout my career, working with the population that I work with currently. And I've worked many places, but yeah, this is probably one of the most rewarding. Is this my last stop? Likely not. I've got a lot that I'm working on currently and that I see in the future. So stay tuned. But I feel like I'm kind of the accidental tourist of nursing. I stumbled upon a lot of my jobs. I'm not the person that's happy sitting down for long periods of time doing the same thing for 20, 30 years. I'm also not the person that likes the conventional stuff. The things that I'm interested in, I knew that I wanted to do the extraordinary. So I'll hear of a position like researcher in Antarctica, and I'm like, ooh, I think I want to do that. So I would say that most of the things I've done throughout my career have never really been conventional, except for that first year on that med-surg unit. And even that, like I said, was not as conventional as most med-surg floors. So I'm just that person that's always looking for something out of the ordinary.
I think that covers all of our speakers, right? Yes. Okay, cool. So thank you guys for sharing. I mean, you guys have had amazing careers. I would sit here and calculate how much time you've spent, and it's probably like greater than 150 years combined in the field of nursing. And just, I am so impressed and inspired by your own personal journeys in nursing. So we have many on the call that I'm sure want to know, what about obstacles? You guys have had amazing careers. We've spoken about the successes and where you've been, where nursing has taken you. So if you could, each of you, just give us an example. What was your biggest obstacle that you faced in pursuing either a position or just in your pursuit of nursing in general?
Go ahead. Go ahead, Dr. Chen.
I would say during my career and in my schooling, I would say being a single mom was rough. My trek up, I've climbed out of. I started from the bottom. I did not grow up in a wealthy family, and I became a single mother early on. I had my son very young, and throughout my pursuit for my bachelor degree, I became homeless. And just, it was hard trying to keep food in my son's mouth and keep a roof over our head, and going to school and just trying to make a better life. So one thing I've always done is I've worked with underserved populations. And one of the things I always do is a lot of times I'll share my story with the people that I'm working with to let them know I've been where you've been. Yes, I graduated from Yale. Yes, I went to NYU. Yes, I have this career in leadership, and, but it took a lot to get here. And I struggled all the way up. But if I can do it, you can do it. And it's possible. If you want it bad enough, you can do it too. And so I just think that that's an important thing for people to hear, is just, yeah, you may be struggling. You may be struggling through school. You may be struggling with financial aid. You may be struggling with, this class that you failed, and you have to take it again if you really want to become a nurse, or if you really want to make it into this program. You might fail the first time, but the end is real. I mean, the reward is real. I can't speak now. So that I think that was the hardest part for me, is just, the struggle, but you can get through it.
I want to echo or piggyback on you, Dr. Schmidt. I think for me, I had my daughter very young. I had an impoverished background coming up. I think the biggest part was in my mind. I had to see myself in that position. And initially, I did not see myself in the role. And like the first question, I just happened, how did I become a nurse? Oh, you know, it's just something that kind of just, nursing chose me. And I thank God for guiding my steps. I remember going to school with my daughter on my back. I'd drive to the college to take a test. I'd get her some McDonald's, sit her in the hall, eat your food. Mommy's gonna take a test. I'll be right back. I would go in class, take the test, come back. I remember going to even clinicals when I was in LPN school. But that was back in the day when you could sit your kids and go and come back and they'd still be there. I'd say, sit right here, eat your food in the cafeteria. I'm gonna run down the hall. I'll be back. And come back and look at her and say, what's wrong? She's like, I gotta go to the bathroom. I said, well, you could have went to the bathroom. I just didn't want you to leave. So yeah, I remember the struggle. A lot of it has to be your determination. You have to see yourself, envision yourself in the position that you want to be in. I think making good choices, centering yourself around people who are positive and people who are going to encourage you and not discourage you, I think is very, very important. One of the worst things I remember was people telling me, oh, you know, you can't do that, or you won't, I don't, yeah. So it was a lot of adversities I had to overcome and rise above. And for my resume, I don't apologize for my resume, because like I said before, if I'm at a job and I'm not happy, I start looking for another job. I always give notice. I always leave the right way, but I'm, you know, headed somewhere else. So it's a matter of what you want for yourself, the sacrifice that you're willing to put forth to get where you want to go, and not taking no for an answer. If you take a class and you fail it, or you take a test and you fail it, sign up and retake it. You know, that's all your experiences come together to make you into the person that you are. I'm a true believer of that. So that would be my contribution to answering that question.
So I guess I'll go next. For me, being an emergency room nurse, it was kind of easy being that bedside nurse, right? I had an associate's degree and it was fine. You do your 312s, you know, you get overtime if you need it. If you need to make money, then that was fine. For me, I think the struggle became when I made the decision that I needed to do more and to come out of my comfort zone. And to come out of my comfort zone also meant that I moved away from serving the underserved, right? Because even when I became a nurse informaticist, I did it in an environment where I got promoted, but I knew that what we were doing didn't match the textbook. So I decided to venture off to a research center. And in that research center, I was the minority. And as being a minority, and I mean the minority, so that imposter syndrome is real. So I had to get past that imposter syndrome and say, Kim, you deserve to be here. And you have the same skill set and knowledge as your coworkers, and don't let them and your dreads, right? And your children with these African names, don't let that make you feel like you're less than. But it was when someone that was hired, right, as my manager or my supervisor, and they were horrible. They was a horrible nurse. It was a horrible leader. And so me and the rest of our team was miserable, but there was nothing I could do. Why? Because I didn't have the credentials, and she had the credentials. She had her doctorates. I didn't have my doctorate. So as someone mentioned earlier before about a doctor, you know what? If she can get her credentials, then I can get my credentials, because I'm a way better nurse than she is. And so that in itself kind of leveraged me to pushing myself through doors that I never thought that I would be, or I would have to practice on this level. Because for me, I was fine with being an associate degree nurse, right, in the ER, taking care of the patients in my community. But I knew that God had had a higher purpose for me, and listening to that voice and taking on that challenge, that was my barrier. And it benefited me and those children, the ones that I was happy to send off for the summer. So we set a stage for them. Like, okay, so we're worthy, and we can do this, and we can be leaders, and we can have doctorates. And so that's kind of like where I'm at now, but that was definitely a very difficult journey to obtain.
I'm so glad that everyone in the panel is being transparent, because people do see these titles and these degrees that we have, thinking that we were born with a silver spoon in our mouths and everything came easy. It did not come easy for me either. People would look at me and think, oh, you have good credit, you don't, have these struggles. Meanwhile, I get those final notices in my mailbox trying to go to school and wondering, okay, the lights are going to get cut off on the 15th. Today is the 10th. How am I going to figure this one out? And that's just one example of my struggle, and we all have those stories. Those that probably should have been my biggest supporters and cheerleaders were not always, did not always serve in that capacity for me. Some people, they like to keep you in a box, because if you are given the opportunity to spread your wings and soar, you're perceived as a threat, no matter how humble you are or how much you try to dim your light. And I think what Dr. Pinckney said, like, you have to envision yourself in a role. So I, talked about early on how I was a chief and didn't know I was a chief, didn't know I applied for the chief position. And I remember walking into the director's suite with all of the other chiefs and in these meetings. And I used to just sit back and wonder, how the hell did I get here? And how am I even going to function? I felt like an imposter too. And then later on, I'm like, how did you get here? These people that are in these positions, they don't know everything. Some of them are not nearly as qualified as you for these positions. And it takes for you to sit at that table and engage with them to understand that they are just as lost as you are. And we are all trying to figure it out. Some people are just capable of putting on that facade and wearing that mask that they need to wear to cover up their imperfections. But we all have imperfections. And just because somebody is in a position, that does not mean that they necessarily belong there or more worthy than you. So another thing too, I just kind of wanted to mention is how horizontal workplace violence has impacted me too. Nurses sometimes are not very kind to one another, and I struggled, especially in certain areas like critical care. In the neonatal intensive care unit, like I said, it probably was one of my most favorite jobs from a clinical perspective, but there were a lot of mean girls there, and it was not very nice, a nice place to work for me. I was, questioned in terms of, is this something that are you sure you want to do this? Are you, not necessarily saying that I wasn't capable, but saying I wasn't capable. Same thing with critical care in adults. We rely on each other for support, not just emotional for everything that we go through in critical care, but also like it's physically demanding, right? And if I have a patient that's crashing and I'm calling you for help, I need you to come. And there were times when I would call for help and nobody would come. And not only does that hurt me, but it also hurt my patients too. I've, literally had to reposition patients myself and extubated them, pulled their airway out, which was, something that really could have hurt the patient. But because people didn't like me, or because I don't even know why they didn't respond to my calls, but that probably was one of my biggest barriers. So that's in a nutshell what my barrier.
So for me, my first obstacle was getting through nursing school. I had 2 teachers my sophomore year tried to get me kicked out of nursing school, which was a shock because I was overall a very good student. Was not failing any classes, but they just didn't like me for whatever reason in clinical. So they were trying to fail me in clinical, which they lied. But I had a wonderful, wonderful nursing counselor by the name of Dr. Kay Battles that stood up for me. And so I was able to get through this and to prove them wrong that they had lied about what I'd done for clinical. And so I was able to succeed with the help of my nursing counselor. So that was the first big obstacle. And then like the previous speaker, the horizontal violence, it was just staggering on the cardiology floor, working night shift, and there's only 3 of us. And this one young nurse, oh, she was such a bully. could not tolerate her because she wouldn't treat the patients. You know, you be a bully to me. You can be a bully to me, but don't you treat my patients, because I'm all for the patients. You treat the patients with dignity, whether they're dying or not. And she was very, very nasty to a man that was dying. And I got her out in the hall and I said, don't you ever, ever do that again to any of my patients. And so she soon left the floor. She left the facility, but she was a Christian. Unbelievable, but she left. So I stood up for myself. And so from there, I didn't have very many obstacles but the critical thing is you have to stick up for yourself and have some wonderful people that will back you up.
Yeah, I'll just add that going to college, I think, was a big clean slate for me. I had a very difficult childhood growing up. I skipped the 11th grade because I needed to escape my childhood. And in doing that, when you start school so young, you have such little guidance and support at home, you're the author of your own story, but like, what is that story? What do you write? What do you do? And so I dealt with a lot of internal anger, just angry that I didn't grow up. Like when you get to a place like Howard, you know, people are 3rd, 4th generation college students, and they're coming with Benzes and Jaguars and coming from very wealthy families. Or people from New York are just really dressed no matter what family they come from. But, you know, you're just this big, you know, this little person in a big sea of people, and you just kind of feel very detached. And so I was extremely angry, just dealing with a lot of emotions. And I ended up going to therapy at Howard, which definitely saved my life, I'm sure. They had free counseling, which I think most colleges have, but I don't think everybody really knows that it was there. And one of my friends one day was just like, "Ooh, I think you need to see a counselor." And I was just like, "It's nothing wrong with me," you know. And I went, and the person who was supposed to do my assessment, I guess she said she just looked at my birthday and thought it was wrong. Like, how could someone be a sophomore and they're only 17 or something like that? And so the supervisor said she just pulled the chart and was like, "I'll do it myself." And so she pulled me in and she was like, "Tell me about your mom." And I was like, "Bah!" Like I just started screaming and crying. And she was like, "Okay, I think you're ready for therapy," and signed me up. And through that, like, I lost my grandfather, I think my first year. My cousin was also away at college. She decided to go home. And I was like, I'm not going home. Like, I don't know what I got to do to stay here, but I'm not going home. And went back to therapy. And I think for me, making sure that you have some type of outlet when you're in school. You know, nursing school was hard. All of the, you know, nursing school is just hard, no matter what type of program you go to, 2-year, associate, LP, it's hard. But I think, you know, your mental health and the traumas that you come into the program with also, or even into your career, you got to process that, because if you don't, it comes out in other ways. And although I thought that I was over so much of that, I still had to end up going back to therapy because I was an angry young nurse, because I used to go off. I'm at one of my friend's house who was there when I started my career, and I would stand toe to toe with the surgeon, and it was just like, you are crazy. Like, and there was some other nurses in there who were just as hype as I was. But, you know, I think I just had to really process why I was so angry, and what was I so afraid of, and why did I feel like I had to stand up for myself so much. And once I kind of sat in, you know, and found my voice and realized, like, you don't have to be the loudest, you don't have to be the strongest, you don't have to be perfect, you can make mistakes. It kind of allowed me to navigate, you know, through my career a little bit easier. The next job I went to was a whole bunch of a lot of older women, so they just mothered me, and I felt like they loved me to a point of healing. Like, you know, I've never found people who just, I mean, when they found out I was pregnant, they were like, "Oh, this is our baby," you know. And it was like that experience, I think, really shifted, because I needed like extra love and extra care and extra support through that. And I think if you find the right environment where you can grow. And so when I was talking about going to law school, and, you know, there were no nurses that I knew who went to law school, or anybody in my life who I knew who were a lawyer. They were 100% behind me. Like, whatever I needed, you know, they were there. When I graduated, when, you know, parties at my house, once I had my son, like, they've been there. When I needed someone to watch my kid when I was in law school, one of the retired nurses came to watch my baby, who I work with at my second job. So, you know, that, to me, it's just like, you got to deal with the internal and never really stop dealing with the internal issues that you have. Because even as, you know, an attorney, it was like, I've never had a full-time legal job. I've done things, I've done consulting, I've started my own practice, but that even made me feel like I've been out of school for so long. And finally, you know, when I found my own lane, which was pretty much last year through the pandemic, and I decided what I wanted to do, every opportunity in the world opened up. And there is nothing that I cannot do there. Like every time I meet with a new client, it's like, oh my God, where have you been my life? You are a godsend. You are an angel. You're the best thing ever. You understand me. You get it, right? And so it's like when you find your purpose and you allow life to put you in the right place and not keep trying to force yourself into other spaces, I think then you find that kind of confidence that I think sometimes nurses are looking for in certain positions that you don't really find because you're not in the right place.
I think I've had a few obstacles. My first set of obstacles were undergrad, and I came from inner city Detroit. I came from a city inside of Detroit. And when I was in high school, everything was easy. It was just, it just was. And then when I went to University of Michigan, I was like, what's this? I'm supposed to study? Oh, you mean, I was like, study? No, we're gonna go out and we're gonna go hang out here, do it. Studying really wasn't in my vocabulary because everything had always come so easy for me. As far as the academic side, the socioeconomic side, no, it had not been easy. I grew up in a single parent household. Like I said, it was in the inner city, so forth and so on. So that wasn't easy. And being at University of Michigan, when there's so few Black students as it was, we were very supported. I will say this, we were extremely supported by the faculty. My dean was Black, a lot, and I had never known any Black women with PhDs outside of a few educators probably in my high school, but never known a Black nurse with a PhD, and we were surrounded by them. There were more Black nursing faculty than there were Black nursing students. So I think getting through those first 2 years, once I got through those first 2 years and made it to the second 2 years, really finding that support system was extremely helpful. I think the next obstacle that I have faced, and I'm probably not facing it too much anymore, but the biggest obstacle I think I faced for years and years and years was always being the youngest person. I got my bachelor's at 22, but was a nurse practitioner by 24, 25, whatever it was. Got my doctorate at 38. So I was just always the youngest person. So people always doubted me. Okay, you don't know anything. And then the last obstacle was the racism that I dealt with. Being the only Black person or one or two Black people, especially in academia, in the places that I was at, that was a huge obstacle. Again, you're younger than everybody else, you're Black, they look at you like you don't know what you're talking about. And then you come in and now you're their administrator. Those were very difficult obstacles. And the last one, it wasn't one that I mastered in my last position. I mean, I left. I mean, I was like, you're not gonna get the best of me, I'm out of here. So I went on to bigger and better things. God always had something better for me. So God declared the path for me, and I had to be willing to take those steps. Not to get all spiritual, but it was about being in the desert. God put me in the desert. I was definitely in the desert, but he rewarded me for being obedient. Obedience is better than sacrifice. I was obedient, and I left where I wanted to be and went back to this dry place, i.e. Las Vegas. And it was dry. Like I said, it took me 6 months to find a job, but God put me in the right place at the right time. So, and the last thing I would say, when I was going through the stuff when I was in Hawaii, I got a tattoo. I always recommend the tattoos, but I got a tattoo that I could look at that tattoo, because that tattoo tells me I'm the smartest person in the room. Doesn't say that I'm better than somebody else, but it always gets me to encourage myself. So I look at that tattoo and say, I can do this. I'm smart. I know I can do this. So that's why I got the tattoo on my wrist, to encourage myself when those people were doubting me and doing everything they could to prevent me from helping them. I'm like, I'm trying to help you. So, but I am where I am, and I'm happy to be where I am.
Amazing, 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 amazing. I could let y'all just keep telling stories all night. Thank you guys so much. Thank you to Erica. Thank you, Vicki, for being our co-moderators tonight. I'm going to kind of switch gears now to, and the hour is late. So I want to find out from our audience. We originally had slated to do some breakout rooms, and I still want to give the opportunity to do that. But I want to share the presentation one more time, just to kind of give everybody an overview of our speakers one more time before I ask for the poll, before we do the poll on which room you would like to be placed in. And I'll provide instructions on that. So we have Ernest Williams, who is our nurse attorney, Dr. Joe Schmidt, clinical operations for the Administration for Children's Services, Dr. Michelle Pinckney, psychiatric mental health nurse practitioner and owner of her own private practice. We have Dr. Michelle Johnson, who is the Director of Nursing Education for the Nevada State Board of Nursing. Marilyn Reidenauer, who is a scientific review officer, nurse researcher, epidemiologist. Dr. Lorianne Vick, who is Chief of Telehealth Service for the VA in Southern Nevada. And Dr. Kim Stevens, who is our nurse informaticist. Okay, so those are our panelists. I'm going to put this slide up at the moment. So this is what I would like our general audience to do. If you have questions that are specific to one of our panelists and you'd like to be placed in a breakout session with them, we're going to limit it to about 10 minutes because the hour is pretty late. So if you have really pressing questions, please follow this instructions, and I'll put the website in the chat for ease of access. pollev.com/DaniaDunkel946. If you can see it here, my mouse is kind of hovering over it. That is where you will go to put your response. Okay. Let me just, and I'm also going to put it in the chat. Okay. Okay, once you cast your votes, I'll be breaking everyone into the breakout rooms. I'll arrange all of that on the back end. Does anybody have any, while we're waiting for everybody to kind of cast their vote, does anybody have any general questions for our panel? You can put them in the chat or you can unmute yourself at this time.
Good evening, can you hear me?
Yes, I can.
Hi, my name is Evelina Jones, and I am about to graduate May 14th, God willing.
All right.
And I had a question. I'm older, so I'm 40, I'll be 44 this year, and I'm just finishing. But I want to go back and get my master's. I want to be a nurse practitioner. So my question is, I don't want to work until I'm 80, but I don't want to be in school until, I don't want to be in school. So what path do you all think, or what advice would you all give me as to what area I should go into to help me go to NP school to finish a little faster, but to be able to take care of my patient when I finish?
Okay, any panelists want to jump in and take that question?
Keep in mind I'm older. I'm a little older. Please.
I don't think there's any incorrect path. I went to school as an NP in my 40s. You can decide to. I think it's good to be, and most schools still have this, where you should work on a floor or as a nurse for about a year to 2 years, and then go back to be a nurse practitioner. But I think some of them are changing it now, where you don't have to have the experience. But I think that the experience as an RN is a pearl. And some people disagree, but I really think experience as a nurse is very beneficial to become a nurse practitioner. So if you can at least do 1 to 2 years, and then you can apply to become a nurse practitioner, you'll still be in your 40s. And it's very doable. Most of the nurse practitioner programs are anywhere between 2 and 3 years. And I think it's very doable. And it'll also give you a little bit of experience to be able to see patients, speak with patients, kind of learn to navigate the system. You won't really learn to be an NP until you're actually really on the job. Even school doesn't prepare you for that. But I do think that it's very helpful if you get nursing experience.
Thank you, Dr. Joe. Does that, hopefully that was helpful.
Do you think like a critical care floor or like a med surge floor to start off at, to get, you understand, to take care of the patient?
The traditional answer was always med surge, because you'll see such a variety of patients, and you'll see a variety of diseases. You'll see a variety of situations, whereas if you go to a specialty floor, you may not see as much. But I do know people that went to a specialty floor and still went to get their nurse practitioner. Also, many ICUs and critical care will not pick you up if you don't have a year as a nurse. Again, there are always exceptions to the rule. But I think if you can get onto a med surge floor, that's great. But I just think just at least being a nurse, wherever you can be, for a year to 2 years is a good jumping point.
I have a question for the caller. Can I ask the caller a question?
Yes, ma'am.
So what is your interest? What field of nursing do you want to specialize in?
Actually, right now I'm an emergency medical technician, and I work in the emergency room right now. And I thought that's what I wanted to do. However, throughout my nursing, I had a couple of areas that piqued my interest. So I was thinking critical care, and I was kind of thinking something where I have to be busy, if you can understand it, because I'm so used to moving around. But definitely no peds and no OB. Those are 2 I can't do. But anything else I'm kind of open to. So I really don't have a preference right now.
Okay, sounds good.
I just want to, hi, Evelina. I've worked with you and I know your skill set and you're awesome. But I want to say, this is not like a rush. I mean, I know age is a factor, but it's not a factor. It's a slow, easy ride. And so, I know that we all have that vision of getting there and being done, but being a nurse, it's almost like you're a lifelong learner. So you're learning always. Take some time, like Dr. Smith has said, and just kind of fill out where you enjoy being that nurse, right? Being that charge nurse, being that primary care nurse, and then take from that to see where you want to specialize in. I mean, emergency nurse is what you know, but it's a slow, steady ride, you know, climbing. It's no rush. If you try to skip the process, then you don't receive the benefits of that. So you want to become that nurse practitioner, but if, like you say, you want to take care of your patients and be that best provider that you can be. So go ahead and finish nursing, get yourself settled, and then see if you want to continue to climb in the emergency services, or if you want to branch off to be a nurse in another specialty. That would be my advice.
I think too, like enjoy the journey. You know, it's not a sprint, it's a marathon. So enjoying the journey and just taking your time. And I know, you know, we think that we always put ourselves on these timelines, and quite honestly, they tend to be unrealistic. So really, like the other panelists said, take the time to figure out what it is you really want to do, because if you rush through, you'll end up in a situation that, you know, really isn't a good fit for you, just for the sake of getting it done by, you know, whatever year you set for yourself.
Okay.
Okay. Awesome.
Thank you.
Thank you. Thank you for that question. So I'm just scouring the chat to see if I missed any questions. I see someone asked, are any panelists members of the USPHS Commission Corps?
I am Marilyn Ridenauer.
Okay. Okay, great. Oh, you answered in the chat. I see it now. Okay, awesome. So, has everybody cast their vote? I see that some results are starting to come in terms of the breakout sessions. Someone asked, wanted to be in the room with Marilyn Ridenauer. Is that Ms. White? Because I'm not seeing a vote on the screen, but that could just mean that you're having some trouble. Would you like to be placed in the room with Marilyn to ask your questions?
I just had that specific question. Hello, everyone. But I thought I voted for Dr. Vick. I just had a specific question about the Commissions Court.
Okay, got it. You can ask now.
Okay. Well, I was interested in applying, and I went through the application for the Commissions Court. And lately, it's been really hard to get any responses, although I went through and requested a chat with one of the officers. So I was just wondering if anyone had any recommendations on how to get your questions answered and how to complete the application process.
So you're asking about the questions and how to finish the application? Is that what the question is?
Well, I put in an application and I requested one of the officers to call back because I had some more specific questions personal to me, but I haven't received a response. So I thought I heard someone, one of the panelists, and you mentioned it earlier in the call. So I was just trying to reach out to see if you had any other recommendations to get a response.
No, I just go through what they recommend and just be persistent. The critical thing is with the situation the country is in, they're going for nursing right now, they're going to want you to be in a clinical role because before, you know, I'm at the CDC. So I'm not in a clinical role. Came in as a researcher. So you're going to have to be willing to go to the Bureau of Prisons or the Indian Health Service or ICE to do clinical nursing at this time because of the need, because of the pandemic. But just my recommendation is to be persistent. Put it on your calendar. If they don't get back with you, email them weekly so that they know that you're really interested and you really want to join the Commission Corps. It's a wonderful opportunity, but it is getting tougher and tougher to get in.
Thank you. I appreciate your time. Yeah, and I think the difference is that I'm in the master's program. I'm in my last year, and I just wasn't sure how to navigate that as a student in a master's program. So I do thank you for your time, and I will go ahead and reach out via email to see if I can get some more information.
Okay. So in the interest of time, because I've only seen 3 persons who request a breakout session, why don't we do this instead of creating the rooms? I think we could just go ahead and ask your questions in this format. And then I'll have each panelist place their contact information if something you think of later that you want to ask that you didn't necessarily want to ask in this forum. So you can go ahead. I would just ask each panelist to put their contact information in the chat. And while we're doing that, the 3 people who had specific questions can go ahead and ask the panelists while they're on now, instead of doing the breakout sessions. So the 3 participants who wanted to ask questions of Dr. Vick, Dr. Stevens, and Dr. Pinckney, you can go ahead and ask your question. You can unmute or type it into the chat, and I will have them respond to you. Okay. Nicole Miles says, Dr. Kim, how do you handle being in an area that is typically not usually female or Black in informatics?
And was that from Tiffany? I'm sorry, Dr. D.
This was from Nicole Miles.
Hi, Nicole. I think first and foremost, after, gaining that confidence that, this is what I do, this is my specialty, and I have a skill set and a gift to give back, right, to improve healthcare, I just focus on that. I focus on my reason of being there and what I have to offer. So to even be in that position and the fact that someone hired you to be there, that you have to just filter out the outside noise and make sure that you stay focused on the purpose of you being there. So whether you're an informatist or whatever you have to contribute to healthcare, we're here to improve the delivery of health so that our patients are healthy, they have access to healthcare, and that we are contributing to their overall well-being. And so I got very comfortable in standing in what it is that I'm there for and shining with the skill set that I have to bring. And I think that once you obtain that, then the people around you, right, understand that you're confident in what you're doing, what you're saying. They start trusting in you, believing you, and supporting you. So that's how I managed it. And if you're having issues with that or any fear, we talked about that impostor syndrome, like you're there because you belong there. So just be confident in that, in your walk, and continue to advocate for the best quality healthcare that we can provide. Let me know if that answers your question, but if not, I did my little slide. Back here. Please feel free to connect with me on any of those channels. I'm very responsive on social media, or you can email me, and then we can talk more in depth if you need a little bit more one-on-one support.
Awesome. Thank you, Dr. Kim. Were there any other questions for our panelists before we close out for the evening? All right. So in the chat, I've asked everyone to put their, all of the panelists to put their contact information if you think of something later on, or you just don't feel comfortable asking in this forum. Their contact information is available to you in the chat. I want to thank each of our panelists for coming on and being so transparent and sharing their experiences with us. I know I've been enriched. We share a lot in common. Some of the things that were said in the stories I could definitely identify with. And it just goes to show you how much we are certainly connected, even though we take different pathways. We all share some connection or another. And it's good to share our stories so we don't feel isolated. And it is also good so that we have resources that we can reach out to, people who have been where we're trying to go, or have an area of strength that we need. So we will definitely try to do more of these events. Like I said, throughout the year, each month will be a different event with the LEBN Leadership Institute. So stay tuned for the save the dates to come. I believe our next event is actually with Dr. Joe Schmidt, who is going to talk to us about workplace violence, which we touched on a lot today, right? So the advertisement and registration information and all of that will be coming out shortly. If you don't already follow us on social media, please do so. We have a Facebook group. We have a Facebook page and we have a Facebook group. So get on both. Subscribe to the website, www.thelebn.com. I'll put it here just in case anybody needs it. Subscribe to the mailing list so you can get updates on things to come. All right. And give us some feedback on things that you'd like to see happen. Right. We're here for you. With that, I have nothing else. Does anybody on the panel have any closing words, any closing thoughts? Awesome. All right. Thank you guys for tuning in, and we will see you at the next event.
Thank
All
you.
right. All right. Take care. Have a
Night.
great night.
Have a wonderful Valentine's Day.
Yes. Happy Valentine's Day.
Yeah.
Enjoy. Be safe. Bye-bye.
Thanks. Bye.
Good night.
Bye.